So we know lymphoma is a cancer arising from the B lymphocytes, and this mantle cell lymphoma is one of the types of the non-hodgkin lymphoma. So usually it is an aggressive type of lymphoma. It can grow very rapidly. Around 5 to 6% of the non-Hodgkin lymphoma cases are mantle cell lymphoma cases. Usually, it affects elderly individuals more than 60 years, and usually predominantly in males. Initially present with a small lymph node swelling, which is usually painless. It will be like minimum of 1 centimeter size. We tend to leave it unnoticed, but sometimes they may grow and they may cause symptoms, like they may feel some obstructive symptoms, breathing difficulty, or like difficulty in swallowing. Patients may have something called as B symptoms, that is loss of weight, loss of appetite, night sweats, and recurrent fevers. Sometimes they may present with abdominal distension or abdominal symptoms when these lymph node groups actually go and compress the intestine or anything. So they may have like vomiting, so they may not be able to take adequate amount of food. The initial diagnosis is made by the lymph node biopsy. Based on that, further additional test may be done on the lymph node biopsy itself, or sometimes from the peripheral blood or bone marrow testing may be needed to confirm the type of the non-Hodgkin lymphoma. So once the diagnosis is confirmed, then we do additional tests for the staging of the lymphoma. So usually it may be either a CT, neck, thorax, and abdomen, or like a PET CT whole body, to find out where all the lymphoma has spread. So depending upon the staging, we may have to consider different modes of treatment. Mantle cell lymphoma treatment, usually it is an aggressive disease, but that doesn't mean that all cases needs to be treated. So wait and watch is also a good option. So depending upon the fitness of the individual, the treatment varies. So if it is a elderly individual who is not going to withstand high dose chemotherapy, we can give a simple radiotherapy and small dose chemotherapy. So if it is a young fit individual, we obviously go for aggressive treatments that may include high intensive chemotherapies. Awareness needs to be created, because most of us, we see a lymph node, we tend to go to a general practitioner. So if your lymph node swelling is not responding to antibiotics or not responding to TB treatment, we have to definitely go to an oncologist or a hematologist for further evaluation.